Hello and welcome back to our channel. Here we discuss various health and wellness topics, the human psychology and personal development to help you live your best life. Happy about this? Like, subscribe to our channel, and tap the notification bell icon to get informed when we release awesome content just like this. Okay, let's begin.
Heart attacks are a serious and often life-threatening. Every year, millions of people around the world suffer from a heart attack, and many of them don't survive. But did you know that many heart attacks can be prevented by making healthy lifestyle choices and managing risk factors? While there are some factors that can increase your risk of having a heart attack that you can't control, such as age and family history, there are many others that you can. Now, let's take a deep look at some of the most common risk factors for heart attack. Number 1, smoking. This is a major risk factor for heart disease and heart attacks. When you smoke, the chemicals in cigarettes can damage your blood vessels, making them more likely to become narrowed or blocked. This damage can lead to the buildup of plaque in your arteries, which can restrict blood flow to your heart and other organs. Additionally, smoking can raise your blood pressure and heart rate, which can put extra strain on your heart. This can lead to an increased risk of heart attack or stroke. Smoking can also decrease the amount of oxygen that reaches your heart, which can cause damage to the heart muscle and increase the risk of heart disease. The longer you smoke, the greater your risk of developing heart disease. It's important to note that the harmful effects of smoking are not limited to smokers themselves. Secondhand smoke, which is the smoke that non-smokers inhale from the cigarettes of others, can also increase the risk of heart disease in non-smokers. Quitting smoking is one of the most important things you can do for your heart health. Within just a few months of quitting, your risk of heart attack and stroke can start to decrease. If you are a smoker, talk to your doctor about ways to quit, such as nicotine replacement therapy, medication, or counseling. Number 2, poor diet. Eating a poor diet that is high in saturated and trans fats, cholesterol, and sodium can increase your risk of heart disease and heart attacks. Here are some ways that a poor diet can harm your heart. Poor diet can cause an increase in cholesterol levels. High levels of saturated and trans fats in your diet can raise your LDL or bad cholesterol levels. This can lead to the buildup of plaque in your arteries, making them more narrow and restricting blood flow to your heart. Secondly, poor diet can cause high blood pressure. A diet high in sodium can raise your blood pressure, which can damage your blood vessels and increase your risk of heart disease. High blood pressure can also cause your heart to work harder, which can lead to heart failure. And lastly, poor diet can also cause inflammation in your body. Inflammation can cause damage to your blood vessels and increase the risk of blood clots, thereby reducing blood supply to the heart, leading to an increased risk of heart disease. Number 3, diabetes. This is the excess of sugar in the body system. A diet high in refined carbohydrates and sugars can increase your risk of developing diabetes. People with diabetes are at a higher risk of heart disease because diabetes can damage blood vessels and nerves. To protect your heart health, it's important to eat a balanced diet that is rich in whole grains, fruits, vegetables, lean protein, and healthy fats. You should limit your intake of saturated and trans fats, cholesterol, and sodium. It's also important to limit your consumption of processed and sugary foods and drinks. Making healthy dietary choices can help you maintain a healthy weight, lower your cholesterol and blood pressure levels, reduce inflammation, and prevent or manage diabetes. By taking steps to improve your diet, you can reduce your risk of heart disease and live a healthier life. If left unmanaged, diabetes can increase your risk of developing several health complications, including heart disease. Here are some ways that diabetes can increase your risk of heart disease. It can increase blood sugar levels, it can increase blood pressure, and also it can increase cholesterol levels. Number 4, stress. Managing stress is also important for heart health. High levels of stress can cause your blood pressure to rise, which can increase your risk of heart attack. Finding ways to manage stress, such as through meditation, exercise, or spending time in nature, can help reduce your risk. Number 5, excessive alcohol consumption. This can increase your risk of developing several health problems, including heart disease. Here are some ways that excessive alcohol consumption can harm your heart. It can cause high blood pressure, irregular heartbeat, obesity, increased in cholesterol levels, and cardiomyopathy, which is a condition that weakens your heart muscle. This can lead to heart failure and an increased risk of death. If you choose to drink, it's important to do so in moderation.
And finally, lack of exercise or physical inactivity is a major risk factor for heart disease.
Here are some ways that a sedentary lifestyle can increase your risk of heart disease. When you are physically inactive, your blood pressure can rise and increase your risk of heart disease. And also, lack of physical activity can contribute to weight gain and obesity, which is a major risk factor for heart disease. But on the other hand, physical activity helps to keep your blood vessels healthy and maintain normal blood pressure levels. Physical activity helps to lower LDL or bad cholesterol levels and raise HDL or good cholesterol levels. Also, physical activity helps to strengthen your heart and improve its ability to pump blood throughout your body. To reduce your risk of heart disease, it's important to engage in regular physical activity. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. This can include activities such as brisk walking, jogging, cycling, or swimming. By taking steps to manage your risk factors, you can help protect yourself from a heart attack and live a healthier life. This includes making healthy lifestyle choices, such as exercising regularly, eating a balanced diet, managing stress, and avoiding smoking and excessive alcohol consumption. If you enjoy this video, kindly like, share, and subscribe to the channel for more health info and health tips. Thank you and stay healthy. Check out our next video.